Can posterior vitreous detachment be treated? In the vast majority of cases, people complain of a few floaters and really doesn't bother them too unduly. Also, as time goes by, after the development of a posterior vitreous detachment, you find that the vitreous gel literally drops down out of sight. The patients get used to the floaters and the symptoms no longer cause a problem. However, there are some patients in whom the floaters become very difficult. They really interfere with their lifestyle. If they are particularly dense, they can obstruct the vision and interfere with their ability to read, and they find that the floaters passing in front of their field of vision is very disturbing. So you can use a laser to disrupt the floaters, but this has varying success and often the symptoms come back. A second option, and perhaps the definitive approach, is to remove the vitreous gel with a vitrectomy. And in this technique, we're using keyhole surgery with 3 1mm incisions, and we literally cut out the vitreous gel through these tiny incisions and a very special probe, and then replace it with saline, and then the eye develops its own natural saline. And this removes the opacities within the vitreous and within the globe, the bulk of the eye. And this will give, in the vast majority of cases, complete resolution of their symptoms. What I would say to patients is that if they have a posterior vitreous detachment and they're greatly troubled by the floaters, to leave it for several months and see if they disappear on their own, and if not, there is a surgical solution which we can offer them that will improve their symptoms significantly.